Where are you going?
We all come over.
Steve, I'll get Stephen to array people. Arrayed behind. Everyone in place.
Took a while.
Well, good morning, everybody, and welcome. My name is Rachel Crowley, and I'm the Executive General Manager for Communications and Public Affairs at Brisbane Airport Corporation. Welcome to Brisbane Airport. On behalf of all of us who work here in particular, I acknowledge the traditional owners on which this airport sits, the Turrbal people, and particularly in this Reconciliation Week, I pay all of our respects to their elders, past and present. This is a really exciting day for all of us at the airport, and most particularly for the people of this precinct. On behalf of Brisbane Airport Corporation and all of us who work here, I welcome the Treasurer and Minister for Trade and Investment, the Honourable Cameron Dick, the Honourable Yvette, who's the Minister for Health and Ambulance Services. Also, and I probably shouldn't have to welcome them to their own facility, Russell Postle, the Chairman of the Royal Flying Doctor Service, and Greg O'Toole, the Acting CEO and CFO, also of the RFDS, and of course Jim Elder, the Deputy Chair of Life Flight. I'm now delighted to invite the Treasurer to begin with this wonderful announcement. Treasurer.
Thanks, Rachel. Thanks, Rachel. Great to be at the Brisbane Airport precinct, an area the size of the island of Manhattan. Today I'm joined by the Health Minister, Yvette, and leaders from Aero Medical Retrieval Services that do such amazing work for Queensland. This is the first opportunity I've had to talk about the 2022 state budget and what it will deliver for Queenslanders wherever they live in the state, especially in this case for people who live in remote and rural parts of Queensland. Today I'm pleased to make a major funding announcement that will be part of our state budget that will be delivered in a couple of weeks' time on the 21st of June. This announcement has two parts. First, I'm pleased to announce that the budget will provide funding to support the construction of a $72 million Queensland Regional Aeromedical Hub right here at Brisbane Airport. This combined facility for aeromedical retrieval and support services will support the Royal Flying Doctor Service, Life Flight, Queensland Health's Retrieval Services Queensland. Our government is backing that deal with grants over $60 million, in capital grants to partner with the RFDS, Life Flight and Brisbane Airport. And secondly, in another major funding boost to improve statewide aeromedical retrieval and support services, to make this facility, the facility that will be built here, one of the best in Australia. The budget will lock in $334 million, a third of $1 billion, to support the RFDS, that's new funding, to support the RFDS over 10 years to support the vital work they do for Queenslanders. It means Queensland will get a world-class aeromedical retrieval and support facility right here at Brisbane Airport. Queensland is a big state, and this facility will help ensure that Queenslanders, wherever they live, including sick kids, are able to get to the health care that they need, particularly in an emergency medical situation. Queenslanders have worked so hard to protect our state from COVID-19, and we can now invest the dividend of their hard work and labour into better facilities and on Queensland Day. I think it's also important to remember that the RFDS has been recognised as a Queensland great. In a state as vast and as decentralised as Queensland, the RFDS plays a role in Queensland perhaps more importantly than in any other state in Australia. The RFDS has 20 aircraft and 9 bases, employs 96 nurses, 71 pilots, 58 doctors and 32 engineers. Last year, the RFDS transported 12,300 patients, including 330 sick children, to hospitals in Queensland. And most astonishingly of all, in Queensland alone, just last year, the RFDS flew 8,370,000 kilometres. That is the equivalent of flying from the Earth to the Moon and back again, 21 times. The RFDS is not just planes and nurses, it is an essential part of our society. The link in Queensland between the city, the bush and the regions has always been part of our state story and defines Queensland as different from other parts of the nation. It binds us together, that link between the city, the bush and our regions. It binds us together economically, but most importantly, socially. Our government's announcement will give the RFDS the clarity and the certainty they need to make this centre happen and to allow them to continue to deliver the important aeromedical services they deliver for Queensland. We'll also co-locate them here with another really great Queensland institution, LifeFlight, and they do amazing work transporting Queenslanders. So we are so lucky in this state to have the professionals with the expertise to make the decision about how Queenslanders can get the medical treatment they need, whether it be via a fixed-wing helicopter, a fixed-wing aircraft or by a chopper. And that makes Queensland different. So this partnership is so valuable and important to Queenslanders wherever they live in the state. And so this new facility between the runways with direct access to the major hospitals in Brisbane in particular, the PA and the Royal Brisbane and Women's Hospital, mean Queenslanders will get the emergency medical treatment they need as quickly as possible and as safe as possible. I'll now hand over to Yvette to say a few words and then we'll hear from our other guests here today.
Well, thank you, Treasurer, and it is an exciting day to announce an additional $334 million for the Royal Flying Doctors Service over the next 10 years. And, of course, the additional over $60 million to go towards the $72 million new aeromedical facilities out here that will bring all of our partners together. And I want to acknowledge our partners, the great work of the RFDS and LifeFlight, as well as Queensland Health and QAS and the Brisbane Airport Corporation. Without this collaboration, we could not be providing this level of service to the people of Queensland, because we know that we live in a very decentralised state and we need to make sure that we can take the services to the people, but also bring the people to those services when that is needed. And I want to particularly, with this announcement of the additional $334 million, acknowledge the great work of the Royal Flying Doctors Service. It is not just an emergency retrieval service. They go out and proactively deliver primary health care to the communities. I know and I want to acknowledge the partnership with RFDS in the COVID response, including taking vaccinations out to the most remote parts of Queensland. And I thank the RFDS, all of the health workforce for partnering with us on that. I also want to acknowledge, I know in recent times, the RFDS have started offering support as far as mental health services. And that is extremely important to be able to go out into those remote communities and offer this support and service. So thank you to the RFDS for doing that great work. To all of the doctors and nurses, our pilots, to all of the staff on the ground as well, we say thank you. To RACQ LifeFlight, we all know, we've all seen those helicopters flying overhead. We know they're on their way either to an emergency or on their way to one of our hospitals to provide life-saving care to someone. And I thank LifeFlight for the great work that they do and the amazing partnership that we have together. I do want to acknowledge our amazing staff across Queensland Health and Queensland Ambulance Service as well. And of course Brisbane Airport Corporation, we couldn't do this without them. And this new facility that will sit as a hub with all of these providers and partnering with our Queensland Retrieval Services here at Kedron. And it's an amazing facility where I've gone in and seen how we transport people, move people around, patient transfers as well, right across this great state. And as I say, that response to COVID and how we're going to move people around safely is state of the art, and as will this facility be. So thank you to everyone, particularly the Treasurer. Thank you for the extra $334 million for the RFDS and the over $60 million for this facility in this year's budget. This is just the start of our health announcements. We know that investing in health is investing in our economy. We need a healthy society as well as
to grow our economy and grow jobs in this state. So I'm very pleased that we are able to be here today and announce that first step in what will be another health record budget this year. I'll now hand over to the CEO of Brisbane Airport Corporation.
Thank you. I'd like to welcome all of you this morning to this very positive and happy event, especially the Treasurer, Cameron Dick, Minister for Health and Ambulance Services, Yvette, and my partners in crime when it comes to developing this fantastic facility, Russell Postle, the Chairman of Royal Flying Doctor Service, Greg O'Toole, CFO of Royal Flying Doctor Service, and the Honorary Jim Elder, the Deputy Chair of Live Flight Australia. And of course all of you, friends of the media. It's very exciting to be here today. The Minister just referred to COVID. We tried to sort of put that behind us, but still a bit challenging, I have to say. But when she brought it up, I actually thought by myself, I really need to thank especially people that have been here throughout the last 2 years of Queensland Health, because they've done a fantastic job together with us in the front line, making sure that all our staff, all our passengers that kept on working here and kept on travelling were safe all the time. So thank you very much, Queensland Health and Minister. I also would like to acknowledge the traditional custodians of the land on which we work and develop this airport city, the Turrbal people. And it's great to be here today to celebrate positive Brisbane Airport related news. After 2 years, we're back. Brisbane Airport's vision for
traditional owners of the land across all of Queensland as they will be part of the beneficiaries of this investment. The fundamental partnership allows the RFDS to continue delivering essential services in regional, rural and remote areas, and gives confidence to those communities that they will be better connected, even better connected to the state's major metropolitan hospitals. We are delighted with the government's commitment to support the construction of our new Queensland Regional Aeromedical Base right here at Brisbane Airport. The critical medical infrastructure upgrade will become integral to the Flying Doctor, Life Flight, Queensland Health and Queensland Ambulance Service, and allow us collectively to deliver life-saving care to Queenslanders across the broad state. The new RFDS Brisbane base will be fitted with state-of-the-art equipment, an innovative operational control centre and a new virtual health hub to enhance our ability to serve Queenslanders. We look forward to working with our supporters and partners to make this vision a reality. Again, we thank the Queensland Government for its ongoing support as we continue